Welcome to Ulosca channel. Access all nursing practice questions. HESI-style maternity child practice questions with answers.
Question 1. Which sign is a probable sign of pregnancy? A. Amenorrhea. B. Fetal movement felt by the mother. C. Positive pregnancy test. D. Ultrasound confirmation. Which one is the correct answer? The correct answer is C. Positive pregnancy test. Explanation. A positive pregnancy test is a probable sign, as it suggests pregnancy, but can be falsely elevated due to other medical conditions or medications. Ultrasound and fetal movement confirmed by a provider are positive signs. Question 2. A client at 32 weeks gestation reports dizziness when lying flat. What is the best nursing response? A. Administer oxygen. B. Encourage deep breathing. C. Reposition to left lateral side. D. Call the physician immediately. Which one is the correct answer? The correct answer is C. Reposition to left lateral side. Explanation. Lying supine can compress the inferior vena cava, reducing cardiac output. Repositioning to the left side relieves pressure and restores blood flow, alleviating the symptoms. Question 3. What is the priority nursing action immediately after delivery? A. Bathing the newborn. B. Suctioning the airway. C. Giving vitamin K. D. Weighing the newborn. Which one is the correct answer? The correct answer is B. Suctioning the airway. Explanation. Clearing the airway ensures the newborn can breathe effectively. This is the first step in immediate newborn care before any interventions such as medications or assessments. Question 4. A postpartum client is at risk for hemorrhage. Which assessment is most concerning? A. Fundus firm and midline. B. Lochia rubra saturating one pad in 15 minutes. C. Small clots in lochia. D. Mild cramping. Which one is the correct answer? The correct answer is B. Lochia rubra saturating one pad in 15 minutes. Explanation. Soaking a pad in 15 minutes indicates excessive bleeding, which is a potential sign of postpartum hemorrhage and requires immediate attention. Question 5. A newborn has a respiratory rate of 68 minutes, nasal flaring, and grunting. What is the likely condition? A. Normal adaptation. B. Respiratory distress syndrome. C. Meconium aspiration. D. Transient tachypnea. Which one is the correct answer? The correct answer is B. Respiratory distress syndrome. Explanation. These are classic signs of respiratory distress, which requires close monitoring and possibly interventions like oxygen or NICU admission. Question 6. A nurse is teaching a mother about breastfeeding. Which statement indicates understanding? A. I should breastfeed every 6 hours. B. I'll give water between feedings. C. I'll feed my baby when she shows hunger cues. D. Formula is more nutritious than breast milk. Which one is the correct answer? The correct answer is C. I'll feed my baby when she shows hunger cues. Explanation. Breastfeeding on demand in response to infant cues helps establish milk supply and ensures the infant receives adequate nutrition. Water is not recommended for infants under 6 months. Question 7. What is a sign of magnesium sulfate toxicity in a preeclamptic patient? A. Deep tendon reflexes +3. B. Urine output 30 milliliters HR. C. Respiratory rate 10 minutes. D. Blood pressure 150/90. Which one is the correct answer? The correct answer is C. Respiratory rate 10 minutes. Explanation. Magnesium sulfate toxicity suppresses the central nervous system. A respiratory rate below 12 minutes indicates respiratory depression, which can be life-threatening. Question 8. A 4-year-old child is hospitalized. What behavior is expected? A. Separation anxiety. B. Stranger anxiety. C. Magical thinking. D. Egocentrism. Which one is the correct answer? The correct answer is C. Magical thinking. Explanation. Preschoolers are known for magical thinking, where they may believe their actions, thoughts, or feelings can cause real-world events, including illness or punishment. Question 9. A nurse is assessing a 12-month-old. Which milestone should the child have achieved? A. Walking independently. B. Using 2-word sentences. C. Scribbling with crayons. D. Playing cooperatively with others. Which one is the correct answer? The correct answer is A. Walking independently. Explanation. By 12 months, most children are either walking or beginning to walk. Language and social development are still in early stages. Cooperative play comes later. Question 10. Which finding in a newborn should be reported immediately? A. Acrocyanosis. B. Heart rate of 90 bpm. C. Moro reflex present. D. Respirations of 40 minutes. Which one is the correct answer? The correct answer is B. Heart rate of 90 bpm. Explanation. A heart rate below 100 bpm in a newborn suggests bradycardia, which can compromise perfusion and oxygenation and should be addressed immediately.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.